Hey Tribe family, it's Marley Page, Clinical Director here at Medical Missions Outreach, and I'm coming to you on location in Jacmel, Haiti actually. A lot of you are familiar with this trip as it was only offered to our tribe members. I'm so excited to talk to you guys today about something that's actually not prevalent in Haiti. It's prevalent in the Middle East and Africa, mainly Africa where we work. You may see this disease come up, and so we wanted to do a little overview, kind of give you a case study and some signs and symptoms and treatment options for this particular disease process. So I'm going to talk to you today about schistosomiasis. This is a parasitic infection that is prevalent throughout Africa. For our purposes, I'm talking about it particularly, we work in East Africa, and this disease may pop up there for you, as it did for me. So the case study I'm going to discuss with you is a 43-year-old female and her children who came into our clinic just this past fall, 2021, in Tanzania, East Africa. So we were working there in Morogoro, which I'm sure most of you have worked there with the Wyatts. It was a great clinic experience, but one of the nurses came to me and said, hey, we've got this patient here with her family, and every single child and the mother have blood in their urine, and we can't figure out why. So it was something that the U.S. medicine had not prepared them for because it's not something we see commonly. And so they were thinking of all these possibilities of what it could be. Luckily, we had a Tanzanian physician working with us as protocol there in Tanzania. And so we went over and discussed the case with him, and he was like, oh yeah, it's bilharzia. And we're like, sorry, what? We don't understand. So then he said schistosomiasis. And so obviously, we had heard this at some point when studying parasitic infections, but weren't familiar with the actual symptoms and treatments modalities for this. So the patients had been in a farm area and had been exposed to this parasite in the water. So you don't get schistosomiasis in the typical way you would think parasitic, like maybe a waterborne illness when you drink or eat. It's more of when you're in the water and it attaches to your skin and enters that way. So most of the time when your patients present with schistosomiasis, it's going to be a person who has been like in a farm area, working in like rice fields where there's like stagnant water, things like that. So they're exposed to the parasite there. So first let's talk about what is schistosomiasis. It's a parasitic infection. It is endemic to sub-Saharan Africa, and it's acute and chronic. It's one of the list of neglected tropical illnesses, meaning that a lot of people think of malaria and more popular tropical illnesses and neglect this one. I'm sure a lot of you are familiar with neglected tropical illnesses, which you can find way more about on the CDC's website and or WHO. The most impactful disease as far as chronicity, so your patients are going to live with this chronic infection, and it can lead to multiple complications throughout their lifetime. So it's not an illness that just goes away and they never see it again unless they have treatment. So as many of you may not even realize, but schistosomiasis has the highest impact of disease effects on a patient, second only to malaria. So it is an important illness to be familiar with prior to traveling to Africa. Schistosomiasis can be caused by 7 different parasites of the schistoma family. The parasite today we're going to discuss is Schistosomiasis hematobium, which is the parasite that infects patients urogenitally. It has the highest rate of mortality and morbidity among helminthic infections, and so it's the one we've prioritized today as it's the one I actually saw in a clinic. And we're discussing the urogenital. So if you guys are interested in learning more about schistosomiasis, I will attach multiple links that will allow you to go and look at each different type and how it works in the body and presents. Signs and symptoms for schistosomiasis can include blood in the urine, which is huge. So hematuria is a biggie. If you have a patient with even asymptomatic almost, and they're just complaining about hematuria, this is one thing that should really clue you in when you're talking to patients in Africa. Another sign and symptom would be flank or abdominal pain, burning and pain on urination. In females, you may see genital lesions, vaginal pain, vaginal bleeding, and nodules in the vulva, which can be difficult to differentiate when thinking of STIs. In men, you may see blood in the sperm. Some of the long-term effects for schistosomiasis are cancers. So squamous cell carcinoma is common, and urogenital carcinomas of the bladder. So these are long-term effects from chronic illnesses of untreated patients. So diagnosing schistosomiasis. Most patients are diagnosed with schistosomiasis based off their H&P. So if you can line up your history and physical with the presenting illness, you're golden. There is a gold standard for testing, however, but is not really accessible in most of the places we are at. If you want to learn more about testing procedures and ways to test your patients if you really feel necessary, there are options for that in laboratories, and you would have to base that on the country you're in. You would have to reach out to one of our clinical directors on the field and decide at that point if it's necessary with your patients. Of course, one quick way is if your patient is complaining of blood in the urine. We know patient symptoms can vary based on what's actually happening. So we can do a quick UA in the clinic and determine if there's blood in the urine. One of the medications, and pretty much the standard of care for treating of this parasite, is praziquantel, which is sometimes not stocked in our clinic. So if you run into this disease, please let us know and we will see about getting it. Most of the time it's available in the areas we're working, and so we're able to obtain this medication for your patient. If we're not able to obtain it right then, we will recommend a place they can go with help and guidance from our local missionary. Follow up with these patients involves the doctor maybe that we have at the clinic with us, which is helpful in a lot of our African communities. Secondly, follow up with the local missionary who is really helpful in getting these patients connected. And then we can also just look for local clinics and refer these patients here. How do you prevent schistosomiasis? So there are a couple of ways. And unfortunately, like malaria, a lot of it comes down to compliance with our patients. Avoiding swimming in rivers and areas of fresh water where schistosomiasis occurs is number one at prevention. However, this can be complicated because your patients may not be aware. A lot of times you can research the local area and figure out if it's endemic to that area, which helps you in guiding your patient. Another preventative measure is drinking safe water. It's not necessarily transmitted by drinking water, as it's not an intestinal parasite. However, it can enter through your lips and the skin around your mouth. Bring water to a boil for at least 1 minute before drinking, which we recommend for our patients with a lot of waterborne illnesses anyway, so this is helpful here as well. Another kind of odd preventative measure that you may not think of is actually vigorous towel drying after being in fresh water. A lot of patients would probably think, what? And they may not even have a towel, but any type of cloth, vigorously scrubbing can actually help eliminate any parasites that may have gotten on their skin while swimming. Okay, so reducing the number of infections in people is another preventative measure. So a lot of times the CDC recommends treating a large area where schistosomiasis may be present, which obviously we don't do in our clinic, but it is something to notice with your patients and ask for the local health departments if this is something they have set in place. I know I didn't mention it before, but the most interesting part of schistosomiasis to me is that snails are actually the carriers of this parasite. So eliminating snails in the fresh water goes a long way. And so a lot of countries have developed methods for getting rid of snails in their fresh water. This is something to look into and to recommend to your patients. Hey, avoid places where you see snails. I'm going to attach a lot of information that you guys should read over. It's very important to know the information so that you can recognize it on the field. As our tribe members, we're expecting you to help those newbies that come along. So help us out, read over it, ask me if you have any questions. We'd love to hear from you. Thank you.